So this study was originally designed as a relapse refractory study, then eventually enrolled into a newly diagnosed cohort. Given the mechanism of action of mosunetuzumab and its efficacy as a single agent, the study was designed as a way, again, to try to improve upon R-CHOP. With R-CHOP, we know that there are about 30 to 40% of patients who will probably have a very poor outcome and will likely succumb to the disease. So as we've been doing since R-CHOP's sort of inception, over 30 years ago, of trying to find a better mousetrap to try to treat these patients with diffuse large B-cell lymphoma. So in this study, after we proved that it was safe to combine mosunetuzumab with CHOP in the relapse refractory setting, the study did enroll 40 patients with newly diagnosed DLBCL to MCHOP. What we did see is that, at least preliminarily from the MCHOP data, the overall response rate was impressive and appeared to be better than what we would see with R-CHOP, with no new safety signals that were not expected. As of right now, the study is still evolving, and we will subsequently evaluate in a randomized portion patients with R-CHIP polar versus M-CHIP polar, again, looking to substitute mosunetuzumab from rituximab. The key part to this study, obviously, is that there's a dose up way of administering mosunetuzumab, given 1 milligrams on day 1, 2 milligrams on day 8, and then 30 milligrams on day 15. This is designed in a way to sort of reduce and minimize the risk of cytokine release syndrome or neurotoxicity, which is very low in very few cases, if any, that were grade 2 or higher in the study population. So this will be important, obviously, if we try to replace rituximab, that, even though we increase the efficacy, we can continue and maintain the safety of this regimen moving forward. And given that now with the new amendment that there's only one required hospitalization on day 15 for the 24 hours, obviously this will allow this to be given in the community, as you obviously won't need to have a prolonged hospitalization for administration of this medication.